Making health and social care information accessible. Update Summer 2016 BSL video with subtitles. The Accessible Information Standard aims to make sure that people who have a disability or sensory loss get information they can access and understand, and any communication support that they need. The standard tells organisations how they should make sure the patient and service users and their carers and parents can access the information and understand the information they are given. This includes making sure that people get information in accessible formats, for example, BSL and subtitles. The standard also tells organisations how they should make sure people get the support from a communication professional if they need it, for example, an interpreter. There's also about changing working practices to support effective communication. By law, Section 250 of the Health and Social Care Act 2012, all organisations that provide NHS care or adult social care must follow the standard in full from the 31st of July 2016 onwards. Organisations that commission NHS care and or adult social care, for example, clinical commissioning groups, CCGs, must also support implementation of the standard by provider or organisations. What does the standard tell organisations to do? 5 things. Number 1, ask people if they have any information or communication needs and find out how to meet their needs. Number 2, record those needs clearly in a set way. 3, highlight or flag the person's file or notes so it's clear they have information or communication needs and how to meet those needs. 4, share information about people's information and communication needs with other providers of NHS and adult social care when they have consent or permission to do so. Number 5, take steps to ensure that people receive information which they can access and understand and receive communication support if they need it. What does the standard include? The standard says patients, service users, carers and parents with a disability or sensory loss should 1. Be able to contact and be contacted by services in accessible ways, for example, email, text or text email. Receive information and correspondence in formats they can read and understand, for example, audio, braille, easy read or large print. Be supported by a communicational professional that at appointments if this is needed to support a conversation, for example, British Sign Language interpreter. Get support from health and care staff and organisations to communicate, for example, to lip read or use hearing aid. For more information, there's a guide online at www.england.nhs.uk/accessible info.